Is it okay if I turn the light on?
Yes.
Okay. Well, my name's Valerie, and I'm going to be your nursing student today. So I need to get a head-to-toe assessment on you. Is that okay?
Yeah, that's fine.
Okay. I'm going to wash my hands before I touch my patient, and I've closed the door for privacy. I've introduced myself. I've explained what we're doing today. So I'm going to identify my patient. And can you tell me your name and your date of birth?
Kilo Akana 1123.
Okay, and do you have any allergies?
Yes, I'm allergic to morphine.
Okay, let me get you an allergy band because they don't have one of those. Okay. Alrighty, and I'm gonna get some gloves on. And can you tell me where we are right now?
Fortis Hospital.
Okay, and what's today's date?
It is July the 16th.
Okay, and what brought you to the hospital?
I've been having some shortness of breath and a cough.
Okay, I think I was reading in your chart that you have a history of CHF. Think we might have a little fluid overload.
Maybe, yeah.
Okay. So my patient is alert and oriented ×4. I'm going to start out with my focused assessment. So for congestive heart failure, someone that's got a productive cough and shortness of breath, I want to do my respiratory and my cardiac assessments first before I start doing anything else. So since you've said we've got some shortness of breath, I'm going to expose the thorax and inspect before I take a listen. So I'm looking for equal chest rise and fall. Do I have equal chest rise and fall?
Yes.
Okay. Do I have any accessory muscle use?
No.
No accessory muscle use. I don't know any heaves or lifts. Skin, there are no lesions. He is clean, dry, warm, and intact. His skin color is appropriate for ethnicity. And I'm going to listen to his lung sounds. All right. Okay, so I've listened to 6 places anteriorly, and then I'm going to listen to 2 places laterally. All right, and I hear crackles throughout anteriorly and laterally. I also need to sit my patient up or roll them over to listen to them posteriorly. And what are my posterior lung sounds?
You were hearing crackles posteriorly.
Crackles posteriorly, and I see that my patient is on 2 liters of nasal cannula. Is that what you wear at home?
Yeah, that's what I wear at home.
Okay, and so I've already checked vital signs. O2 sats were 96% on 2 liters, so I don't need to do anything with that. Have you had a cough?
Yes.
Okay, when you're coughing, are you coughing anything up?
Yeah, a little bit.
Okay, what color is it?
It is clear.
Clear. And what's the consistency? Is it like real watery, thin? Is it thick?
It's pretty thin.
Thin. And then is it a lot or a little or just kind of in the middle?
Kind of in the middle.
Okay. So next time you cough something up, let's get a sputum sample so we can send that down just to make sure you don't have an infection.
Okay.
And next I'm going to do his cardiac assessment. So I'm going to listen to all of the heart sounds with the diaphragm and the bell of my stethoscope. And then I would ideally do the apical pulse for a full minute, but I'm going to listen at Erb's point just because it's easier to hear on Apollo. Okay, so I've got my diaphragm, and this is the aortic and pulmonic, Erb's point, tricuspid, and mitral and apex. And then I'm going to listen with the bell side of my stethoscope. Aortic, pulmonic, Erb's point, tricuspid, mitral, and apex. Okay. And then I'm going to listen at Herb's point for a full minute. Okay, so after a full minute, I've heard S1, S2. There is no S3 or S4. I did not know any murmurs. His rate is about 70 beats per minute, and he has a regular rhythm. Next, I'm going to inspect my upper extremities for any presence of edema, which I do not.
Edema noted.
Okay. All right, and I'm going to do capillary refill on both sides.
Less than 3 seconds.
Okay, and I'm going to feel of my radial pulses. They are 3+ and equal. And I'm going to expose the lower extremities. I do see some edema on the lower extremities. What is the rating and is there pitting?
You have 2+ pitting edema bilaterally.
Okay. And I'm going to assess my dorsalis pedis pulses. They are 2+ and equal. And the posterior tibials, also 2+ and equal. Capillary refill.
Less than 3 seconds.
Okay. Alrighty. And ideally we have our tele monitor on, so I would identify his rate and rhythm.
So he is sinus rhythm
Okay.
and rate is 75.
Okay. All right. So I'm done with my respiratory and my cardiac. So I'm gonna finish up the rest of my head to toe now. All right. So with my pen light, I'm gonna assess pupils. They are round. They are equal. They are briskly reactive to light. They are at about a 7 millimeter and they constrict down to a 4. Next, I'm going to have my patient do accommodation. So I need you to look at the far wall. When you see my pen light in your vision, just start to follow it in towards your nose.
Eyes appropriately accommodate.
Okay. All right. And then I'm going to look at the conjunctiva and the oral mucosa. I do not see any skin breakdown. And are my mucous membranes pink and moist?
They are.
Okay. And I'm going to check skin turgor while I'm up here.
Non-tinting.
Okay. All right, and I'm going to finish looking at the skin on the anterior side. I'm going to expose your abdomen. So I'm looking at contour and skin condition. Abdomen appears rounded, no masses, no hernias. Skin is clean, dry, and intact, no lesions, no wounds. And have you had any kind of abdominal pain?
No.
Okay, so next I'm going to listen. So right lower quadrant, right upper quadrant, left upper, and left lower. Okay, and bowel sounds are active in all 4 quadrants. When was your last bowel movement?
This morning.
Okay, and how often do you normally have a bowel movement?
Usually every day.
Okay, and what was the consistency? Was it liquid, formed, hard?
It was soft.
Soft and formed?
Mm-hmm.
Okay, any abnormal odors?
No.
Okay, and what color was it?
It was brown.
Okay, and so you've not had any issues with diarrhea, constipation, pain?
No.
Okay. All right, and then next I'm going to expose my external genitalia. Patient does not have a catheter, so I'm inspecting the skin for any lesions, discharge, rashes, or drainage, odor, which I do not note. And when was the last time you voided?
About an hour ago.
Okay, and what was the color?
It was pretty light, like yellow.
Okay, and the clarity, could you see through it, or was it cloudy, had stuff floating in it?
I can see through it.
Okay, any abnormal odor?
No.
Okay, and do you know about how much you voided?
I measured it in the urinal and it was about 300.
Okay, good. So does that seem to be about your normal?
Usually.
Okay, have you had any pain or burning?
I don't know.
Any issues with urgency or frequency?
No.
Okay. I'm gonna finish looking at the skin. So we've got the edema, but I've not noticed any other wounds, lesions. Again, skin is still clean, warm, dry, intact, appropriate for ethnicity. I'm also gonna turn my patient so I can inspect the skin posteriorly. Do I have any breakdown?
You do not.
Okay. And then we're gonna do a musculoskeletal. So squeeze my fingers hard as you can.
Strength 4 out of 5.
Okay.
Bilaterally.
All right, and push against me
4 out of 5.
and pull.
4 out of 5.
Okay. And for your extremities, lift your right leg.
4 out of 5 on the right.
Okay, lift the left.
4 out of 5 on the left.
All right, push down like a gas pedal
4 out of 5.
and pull your toes up towards your head.
4 out of 5.
Okay. Full range of motion, strength 4 out of 5. Generally, I need to assess his IV site. So I've got a 20 gauge in the right forearm. It was inserted yesterday. My dressing is clean, dry, and intact. I do not note any signs of infiltration, no phlebitis. Are you having any pain at your IV site?
No, I'm not.
Okay. And it looks like I do have IV fluids running. So I have normal saline. It is running at 100 mLs per hour, which is what's ordered. And it is not expired. It expires in 12 of 2028. Okay, Mr. Akana, so I'm finished with my head to toe. I'm gonna go talk to the doctor about the sputum that you've been having. And then I'll come back and check on you just here in a little bit. So I'm gonna make sure that my bed is in the lowest and locked position. And it is. He is a fall risk because he does have oxygen and an IV. So I'm gonna make sure that my alarm is on. I have 3 bed rails up, no more than that because that would be a restraint. Do you need anything before I leave?
No, I don't think so.
Okay, I'm gonna make sure that my room is neat. There's nothing in the floor, clear walkways, and I'm gonna give my patient his call light. Okay, so you just press that little red button if you need me for anything.
Okay.
And since you are fall risk, I am gonna leave the door open.
Okay.
And before I leave the room, I'm gonna take my gloves off and I'm going to throw them away and I'm gonna wash my hands.